are you?
I'm good, how are you?
I'm Arthur, and you are?
I'm Debbie.
Debbie, nice to
I'm
meet
Sophia,
you.
I'm working with Asha.
Hi.
Arthur. Mhm.
Hi, Katie.
And your relation is?
Hi, Katie.
Her partner.
Oh, awesome,
Nice to meet you
awesome.
guys.
So congratulations.
Thank you.
Is this your first child?
Yes.
Okay, awesome. So we're
What is the
gonna,
baby's name?
Oh, Holden.
Holden?
Yeah.
Is
It's a
it okay
family
if we-
name.
It's a family name. Is it okay if we look at Holden?
Sure.
Okay, Sophia,
Sure.
here's
So
just
I'm
gonna.
gonna take a look at the baby and then he's gonna kind of walk you through what
Walk
I'm
you
doing,
through what's
okay?
going on.
Okay.
So,
I take some blankets
yeah,
out of here.
just know for when you guys go home, a really thing that we try to prevent is SIDS, sudden infant death syndrome. And a great way to prevent that is to kind of have the crib clear of all blankets, any side bouncies, kind of those
But what if
railing
he gets cold?
So you're gonna swaddle Holden at night, you're gonna kind of keep him in swaddle, and we can teach you how to do that by tucking the arms kind of up and swaddling him over. You'll keep the cap on, such as he has on right now, and he is in a onesie, so things like that will keep him warm. You just don't want blankets that are loose and kind of around the cribs. So that's, a really good thing and something that we strive to. So most stuffed animals, I know you're gonna have a lot of friends that come over and are giving them toys and stuff, and just make sure they're not in the crib.
So we're gonna have to take that bunny out.
Yeah, it matches the room, but okay.
Aw, yeah, to keep you safe, for sure. So, as you can see, so what, have you been breastfeeding, or are you gonna be on?
We've been breastfeeding. It's been a challenge. The first night, he did really well, and then just yesterday, he wasn't into it at all, but this morning and so far today, he seems like he's a little more into it.
Okay, so how's, he latching, is he latching well, finding?
I mean, the lactation consultant said that he was, when he did latch, he was doing good. He just didn't really seem interested in it yesterday.
Okay,
He was really sleepy.
So you're gonna kind of wanna watch out for those cues in the future, especially with discharge, to keep an eye out when Holden isn't eating a lot or is more tired than usual. And he is a little, so that little yellowish tinge is called hyperbilirubinemia. So that is normal. Sometimes it goes with when they're starting to pass stool, so that will start to go as you feed more, and there's sometimes even sunlight can help.
Is that abnormal?
It's not abnormal, it's seen in a lot of pregnancies, especially male, and he was large for gestational age, so sometimes that puts a little bit more trauma as far as the blood loss in a child, or when they're kind of going through and compressing the head. So it's normal for Holden
Do we
here
need to do
have that.
anything for it?
For right now, the levels aren't concerning, just continue monitoring that, the lethargy and the lack of feeding, but as you said, that feeding kind of picked back up, so just monitor and look for cueing from Holden. So Holden's gonna smack his lips, he's gonna kind of start to give that sucking motion, that brooding, you're gonna see that in him, and that's a cue for you that it's time for him to eat. Don't keep him on a sleep schedule, feed him.
I have to wake him up to feed him.
He shouldn't be making those motions when he's sleeping, but if he's crying, it's gone too long, and he'll definitely need to eat, but he'll start giving you signs with his facial structure that he's ready to eat. So kind of keep an eye out for that.
And breastfeeding is definitely better than formula.
So breastfeeding is wonderful for the baby because it gives passive immunity to Holden, so he's gonna be able to fight infections better, and he's gonna be able to kind of deal with more of those viruses and everything, especially in cold season right now. You're gonna be giving some immunities over to him passively through that breast milk, so it definitely is, if you're up to it and you're able to do it, it definitely is what we recommend the most.
I think I'm gonna do it all the time, except for like at night. I heard that if I give him a little bit of formula, he'll sleep better through the night.
I would keep him consistently on the breastfeeding as long as possible. If it's about being tired and you guys wanna split, you can also pump, and we can have the lactation consultant come and show you
Oh, that
how
might
the
be nice.
machine
Then
works
you'll
and
get some
stuff.
time.
And then you get some time, and keeping Holden close, and that skin time will help regulate that temperature, which you guys were worried about also. So and that will create the bonding experience for both of you and give you guys both that opportunity. So that will be
That's a
awesome.
great idea.
Yeah. So we're gonna continue looking over here. We're gonna go ahead and take a listen to his lung sounds and some heart and see how that is.
Yeah, he's got that weird rash. We're gonna have to bring that lotion in and put that on.
Oh goodness, so So lotion on a baby, you're gonna wanna not put lotion, so that's called erythema toxicum. It's
It's
okay.
toxic?
It's not toxic, it's just in
It's
the
a
name.
horrible name.
It is, it's a pretty awful sounding name for a very benign, nothing rash. So you could tell us that he has a rash today, bring him in tomorrow, and that's moved to his leg. It's
Is it
just as
contagious?
open as- It's just as he's adapting, kind of even all that, just kind of learning new textures, anything like that. It's just his adapting and his blood vessels adapting and his skin adapting. So that will kind of transition and you may see it on his shoulder one day, anywhere the other. So
Okay.
that's gonna be perfectly normal and nothing to worry about.
Nothing to put on it?
Nothing to put on it, so.
Okay.
We'll go over when we get down to, because Sultan's had circumcision, when we get down there, so the only kind of ointment that we're gonna talk about is gonna be petroleum jelly down there, so we're gonna, put that on the gauze pads, and we'll show you how to do that when we go check his diaper. And you're gonna put it on the gauze pad, not on his penis directly, because we don't want that.
Okay.
Can we bring him over here so we can see what
Of
you're
course.
doing?
Of course. So, while we're undressing him too, a good thing to point out here is, so when you're gonna bathe Holden at home, it's definitely something you're gonna wanna, prepare first. You're gonna wanna have everything ready for the bath. You're gonna get, a washcloth, you're gonna get, the water ready, and then start getting him. You're gonna take his head first, and you're gonna kind of wash that off with a cloth, and then you're gonna start moving down until his umbilicus falls off. You're not gonna, and starts healing fully, you're not gonna wanna submerge him in water. You're just gonna use kind of a washcloth, and you're gonna continue to go down, and then dry him as you go, just to keep him warm. Once again, that warmth is very important. Babies have, a lot of heat loss because they can't shiver like we do to keep us warm, so you're gonna wanna keep that in mind.
What will the umbilicus look like when it's healing?
When it's healing, so it will dry and it will kind of fall off.
And that, like that black color, that's normal?
That's pretty
For now it is,
Okay.
yes. And then once it falls, it's gonna seem like a healing, like a healing wound kind of thing that will just kind
Okay.
of go, so that will be normal to look at.
Always make sure the diaper is below, because you wanna see
Yes,
your.
you'll kind of fold this until it
Okay.
run down like that, and that will keep the hair away.
I know.
Yeah, it's a lot, and you can always call, you can look some of it up, but always double check any kind of information. We don't like to, advertise the internet as all questions answered, because it's easier to call when it's perfectly normal to kind of feel overwhelmed at
So I
times,
shouldn't go
but
to Dr. Google?
Dr. Google is
No,
probably
Google's not
not
your
the best
friend.
thing, especially with a baby.
You put a little bit amount of Vaseline in the gauze pocket.
And so while we're also looking at his diaper, so you're gonna wanna monitor Holden's,
Is it supposed to be that red?
yes, so especially with that being said, you're not gonna wanna try to brush that off, especially when you have the clotting and stuff. You're just gonna kind of, with a mild soap like she did, you're gonna kind of, warm water, you're just gonna kind of brush it, but
What is
don't-
in his diaper?
I just need to
It's-
clean it.
it's
I think you need to
yellow.
go
Oh,
back.
that's okay.
It's pretty normal since he's breastfeeding.
It looks like mustard.
That's a good color to have, a little seedy, the golden brown color will be a very good
After a couple of days.
indication that that's good.
Are you sure?
Yes, so any
Positive.
abnormal colors you're gonna wanna look out for is if it starts turning green for any reason, it starts getting a tarry black consistency. Those would be cause for concern. If it continues
That
down this.
first poop
I was
was
just
that
gonna
black.
say.
Yes,
Yeah,
so
it's
that's
pretty
called
wild.
zirconium, and he has nothing in his floor at the
It took
time.
like 12 wipes to get that stuff off.
Yes, very sticky, so if you start seeing that again, we don't wanna start going in that direction with the color, so.
Will the poop always look like this, that seedy
It's
mustard
gonna start
looking?
becoming more well-formed as his digestive tract, and especially as we start moving on
Okay.
with breastfeeding
Because
and
right now it's
everything into food
transitioning
transition.
between like from being in the mother's womb to the outside and eating food.
So
Okay,
you can see that transition.
I should be taking notes.
I know.
This is just a diaper.
Almost like we should record all of this.
And come back to it later and
So we
keep
could watch
reviewing
it,
and
yeah.
reviewing it, I can only imagine what that must be like
With
for
those
someone.
3 AM feedings.
So with the diapers, once again, so you're gonna
Are we
wanna.
supposed to put that pad thing over him?
Yes, for his God pad for the circumcision, you're gonna wanna do that, so very good. So especially too, you're gonna be doing this probably 6 to 8 times a day or 8 times a day or so for when he's urinating. You're gonna those voids, a lot of diapers will have an indicator, and that's gonna be a good way to know that feeding is going well. He's eating
And he's
enough.
gotta pee like 8 times a day?
About 8 times a day, you're gonna wanna see, so you're gonna see that, and that will indicate it's a good, he's feeding well, and his energy levels will be up, and you'll see that, so.
Is he supposed to poop that many times a day?
No, he's not gonna poop that many times a day, that will all vary depending, so, on the child, just like an adult would. Some days it changes the amount, some days it's gonna be more, some days it'll be less.
Okay.
Earlier today, the nurse said that he lost a little bit of weight.
Okay, so.
Should we be
Is that
worried
because
of
he wasn't
feeding?
getting breast milk? Maybe we should just
No.
switch to formula.
So that's a perfectly normal thing to happen. He may lose up to 5 to 10% of his birth weight over the next few days, and that will slowly start coming back as he starts regaining. So a lot of that is keeping himself warm. He's burning off all that extra energy. He's burning off some brown fat to keep himself warm, and he'll start gaining that back as formula, as your breast milk starts to feed him, and he starts resting and adapting to life and not having to kind of put all his energy into adapting to extra uterine life, so.
I know, you need like a PhD to figure out those onesies. I don't know how I'm gonna do that in the middle of the night. It's like 42 snaps.
You'll figure it out, it'll all come to you slowly, and that's okay. So other signs, so I'm trying to think of other signs you're gonna wanna look out for. So Holden's gonna be doing things like sneezing and coughing, and those are gonna be normal. It's not unusual to have them cough or sneeze. If it starts becoming a lot and you start seeing a lot of his muscles start to contract in, or you start seeing any, it sounds kind of cute when they, a little wheeze, or kind of what we call a grunting. Let us know if any of that happens. That is a cause for concern. It might sound cute, but it is not cute for them. That would be something that you would call the doctor about. And kind of look for that, right, like she said, nasal flaring, or kind of the ribs kind of pulling in. If you start seeing that kind of respiratory effort, that would be something to be concerned about. But normal breathing, they breathe a lot faster than we do, so you're gonna kind of see the chest movement.
So my mom told me it was really important to let him sleep on his belly so that his head doesn't get flat.
No, so that's, that's not gonna happen, so the head will form naturally, it will form normally. You're gonna wanna keep him on his back, once again, in a clean crib. Back sleeping is what's best for preventing SIDS, so we definitely recommend.
I feel like we got all the wrong
back.
information.
It has changed. A lot of people will tell you many things. Oh, I sleep with my kids. That's another thing you're not gonna wanna do, not in your bed. I know a lot of people, especially when you're doing that skin to skin, they may fall asleep and you may say, oh, it's so cute, let's fall asleep together. Definitely don't do that. You're gonna both be very tired with your sleep schedule changing. If you start feeling that you're getting tired, put him down. It's not a great idea to kind of, it looks cute in those pictures and you see a lot of parents do it. We just recommend that, once again, for the safety of Holden and anything happening, to always put him back in his crib on his back if you start feeling tired as well.
Sometimes I watch and it seems like he pauses his breathing, like he stops.
Like he stops.
Yeah, so that's gonna be, once again, another normal situation for no more than 15 seconds. So
And
if he
make sure
starts
his skin color isn't changing,
changing.
and
Okay.
his heart rate isn't going.
What do you mean skin color changing? What would
So,
change?
he's pink right now, you turn a little blue. which
Okay,
you
like
notice
your scrub
in-
top.
Well, not this bad.
Hopefully,
Okay.
hopefully not like that.
Okay.
But a little bit, yeah, it would start turning
Okay.
a little bluer, and that breath holding would be a little bit more than 15 seconds or so, so things getting up to 30.
But his hands and feet look blue sometimes.
So
Especially
that's
when he cries
keeping
really
warm,
hard.
and so you're gonna see that those, especially when he's doing that, that's gonna be a lot of his energy, and his breath's going into
Okay.
crying, so you're gonna see that happen with
Is
him.
that okay? The
And
blue
that's
there?
pretty okay.
Okay.
Yes. Yep,
This
that's
is a lot to know. We really should have gone to one of those classes.
I agree.
It is.
But if you guys have questions, you feel free to call the doctor, or you can call us here.
Okay.
We can answer any questions that you guys
I
have.
think we have an appointment, 4 days from discharge?
It should be up to 4 days.
Okay.
And make
So
sure you
they're
guys
gonna double
keep your
check that
appointments as much
jaundice
as you can.
looking color to make sure that that's resolved on its own, like we were talking about the hyperbilirubinemia, and that should resolve on its own, but that's another good time to check that. And they'll check Holden's birth weight at that point as well.
What will happen if he keeps getting more yellow?
So if the yellowness continues, what they might do is they may readmit or send you home with what's called a billy blanket. So it's essentially, I would say, a tanning bed. not really tanning, but it's those same blue lights, it's that creation of sunlight, and that will help break down that extra bilirubin that's in his system. It will conjugate it and allow him to pass it.
So if it's like a tanning bed, can I just take him outside, like on it when it's nice
It would
out?
be, yes, if it's a warm day out, you can definitely do that. Not right now, unfortunately, where it's really cold out, but in a warmer day, I would definitely say that that's something you can also do to help it resolve on its own.
Do you guys have any questions about the car seats and everything?
I don't even know anymore, there's just so much.
So car seats are good.
Car seats, yeah.
You guys have your car seat?
Yeah, car seat.
Mhm.
Yep, it's already in the car.
Already in the car, okay.
And make sure it's rear facing until it's about maybe like 2 years.
Okay.
Let's see for him with height.
And just well tucked in, and but once again, same rules apply to his car seat as to his crib. No blankets, outlying, no stuffed animals with him. Always
No
kind of just very
toys.
much on his own.
So he got the one shot, the day of
For his vitamin
delivery.
K.
But he got another one, right? One of his immunizations?
Hepatitis B, so that will
Yeah,
be a
that's right.
series, so he's gonna follow up, it'll be 2 more shots that will come after this series, and those will be scheduled with the primary care physician.
When will he get more shots? I don't want him to get an infection in the winter.
You shouldn't be getting an infection, once again, with that breastfeeding, and always making sure to wash your hands, or when people come over to wanna touch and hold them, make sure that they're washing their hands, especially in this time where if you see anybody that comes over and they have a runny nose, or they're coughing a lot.
We have a really big family.
Yeah,
Yes.
they're
I'm
huge.
Italian.
And you may have to be that mean person that says, you know, unfortunately, you've been blowing your nose a lot when you walked in, or you're coughing, you might be able to do a mask, but you're gonna wanna kind of monitor for that and make sure that they're not touching, just for the safety of holding.
Okay,
All right.
we can do this.
Yes. You guys got this.
I'll let you take your call now. Do you guys have any other questions?
No, I think we're good for now, thank you.
Thank you so much.
You're